Take a look at this map of the United States. As it zooms in on Wisconsin, you'll see data points flashing across the state. These represent projected healthcare premium spikes for 2026. Because the Affordable Care Act's enhanced subsidies are expiring, we are looking at national increases averaging over 100%. In parts of Wisconsin, those spikes hit as high as 800%. As the map dissolves into this line graph, the real-world consequence becomes obvious. Without the financial relief originally provided by the American Rescue Plan, analysts project millions of Americans will drop their coverage entirely, causing a steep, sudden plunge in the number of insured citizens. This segment is sponsored by the Milwaukee branch NAACP. To understand how a federal spreadsheet translates into a local crisis, we need to look at Milwaukee. Even before these subsidies expire, the 2025 City of Milwaukee Community Health Assessment paints a stark picture of the baseline reality. Right now, 15% of adults in the city lack a regular healthcare provider. Pushing these massive premium hikes onto a city where the Black community already battles such severe health disparities turns a financial obstacle into an immediate public health emergency. This flowchart breaks down what public health officials call social determinants of health. Instead of looking at genetics or diet, it maps out how environmental and economic factors, like housing quality, income levels, and access to education, dictate a person's physical well-being long before they ever set foot in a clinic. In recent focus groups, residents pointed directly to the physical environment as a primary driver of illness. Living in older housing stock means dealing with mold, daily lead exposure, and the constant looming stress of eviction. That environmental tension compounds. The chronic stress induced by systemic racism and the daily fear of neighborhood violence physically manifests in the body, driving up emergency room visits for stress-related conditions. Prescribing medication for a symptom is futile if the environment a patient returns to is actively making them sick. That is exactly why local health officials are pivoting to treat these underlying determinants. When we examine the data, the impact of those root causes on Milwaukee's Black community is severe. It starts with maternal and child health, where the city currently records one of the absolute worst infant mortality rates in the United States. This bar chart puts the racial disparity into sharp focus. Black infants account for only 38% of total births in the city, but they make up roughly 2/3 of infant deaths. As data transitions to chronic disease, we see the same pattern. Heart disease is the top killer overall, with mortality for Black residents at nearly 1.5 times the rate for white or Hispanic residents. Those environmental hazards we mentioned earlier play a direct role here. Older, dusty housing stock triggers disproportionately high asthma-related emergency department visits in predominantly Black neighborhoods. Then there is the toll of violence and injury. Fatal overdoses have surged in recent years, now accounting for nearly 20% of all years of life lost in the city. Add in community trauma and gun violence and traffic crashes, and the result is a severely stunted post-COVID life expectancy recovery for Black residents compared to every other local demographic. This interconnected web of systemic failures creates a severe baseline of physical vulnerability for Black Milwaukeeans. This brings us back to the impending economic shock. At the Wisconsin state capitol, lawmakers have not implemented any state-level offsets to cushion the blow of the expiring federal subsidies. Meanwhile, Milwaukee's Black residents rely heavily on subsidized ACA marketplace plans to afford the ongoing management of those exact chronic conditions. When premiums spike by hundreds of dollars a month in 2026, families will be forced to drop their coverage. That guarantees delayed preventative care, allowing manageable conditions to spiral into fatal complications. Local healthcare providers, including the outreach community health centers, are already actively preparing for a massive surge in uninsured patients who will have no choice but to rely on already overloaded emergency rooms. The 2026 subsidy expiration acts as a devastating catalyst. It pours gasoline on an existing public health crisis by stripping away the only affordable tool marginalized communities have to survive their compounded health burdens. The city has been trying to build a different path. Initiatives like MKE Elevate are designed as upstream strategies, treating root causes like housing instability and a lack of economic opportunity to prevent illness from starting in the first place. But that local progress collides directly with federal inaction. The refusal in Washington, D.C. to extend the American Rescue Plan subsidies threatens to completely unravel these holistic interventions. A sudden, massive surge of uninsured residents will force the city to divert critical funding. Money meant for proactive, community-based prevention will have to be funneled right back into reactive, highly expensive emergency triage. Milwaukee's ambitious attempt to build an equity-focused healthcare landscape is incompatible with a federal environment that actively prices its most vulnerable residents out of basic care. For marginalized groups battling deeply entrenched systemic inequities, healthcare policy functions as a literal life-or-death shield. Fighting for equitable healthcare access requires immediate cross-sector collaboration. Treating the social determinants of health is an impossible task if residents can no longer afford to walk through the clinic door.